record it down. Okay, so yeah, so Dr. Shaida, I hope you're here. This is your letter. I asked you guys to write the letter number 5. I hope you all have written that one. Dear Dr. Dev Desai, age is fine, no problem. Karen Jackson, 36 years old. I'm writing to refer Mrs. Jackson, whose anxiety level is increased due to moving to power today. I would prefer if you write has increased, it would be better. Your further assessment and management would be very appreciated. Okay, fine. Mrs. Jackson is a married, a hairdresser, saloon manager, and has one child. Is married, okay? Not is are married, is married. Okay. She participates in recreational sports. She is a non-smoker, however, she drinks alcohol. Currently, she is taking multivitamin. Okay. On this state, Mrs. Jackson presented with a complaint of mild anxiety. She was prescribed medications and was counseled related to lifestyle changes, but she refused as she was planning for another child. On subsequent visits, she reported of being anxious due to coping with baby, and her pregnancy was confirmed. On today's visit, Mrs. Jackson presented with the complaints of increasing anxiety levels due to moving to Park Village, poor sleep, and poor appetite. She is anxious regarding losing her work, not to family and relatives. Her current pregnancy is without complication. Therefore, she requested a home delivery, okay, which I would not recommend, which is not recommended because she has had complications, not had. See, everything you have written in the present. Now, what you're doing, you have written this had to make it past. That's wrong, right? She has had complications during her previous pregnancy. Regarding Mrs. Jackson's past history, okay, see, Dr. Saida, now what you have done, you have created an envelope, okay, a very nice envelope, which is, you know, very bad way of writing a letter. Why I'm saying that? After the purpose, you have written about she's married, has a child, works as a saloon hairdresser, okay, manager, smokes, drinks, okay. And now that was the social history. And inside, after the social history, you have written the letter, okay. And now again, you are, the second side of the envelope, you are ending with the past medical history. See, I taught you guys that whenever you are writing a history, write everything in the single video. This was a GP to GP reference. Okay. First thing, she is married. It's fine. You can mention it, or a hairdresser. Okay. Or, she has a child and this and that. These things, if you somehow skip it, it won't matter. The important information should be written. And whenever you're writing a history, write it in a single paragraph. Why will you make a envelope in which you will write a letter and inside both of the sides are covered with the history? Okay, you don't need to do that. Okay, this is the worst way of writing a letter if you write this way. So till here, her previous pregnancy, till here your letter was fine. Now, because you have mentioned the past medical history at the end, okay, now everything is gone. Okay, please, whenever you're writing, I told you guys, I have taught you so many times, please follow that structure. If you not follow it, you will not pass. I'm making it clear. You will not pass. I can write this on a blank paper if you it. Okay, you will not pass if you do that. If you will not follow the structure, I tell you guys, that is not my structure. That is not something which I have made. That is given by the official OET. okay, centers. They have made it. They have given you the structure. I'm just guiding you. If you'll not follow that, they are not gonna pass. You're gonna lose your 1,25,000 rupees. Along with that, you're going to lose your time, effort, okay, and your brain, because you guys are going to be in a stress. Okay, so you're actually going to lose your peace of mind. Please follow that. It's a request. Okay, then, and this is no, there is no need to write that she works as a hairdresser, this and that. I mean, if it is not very much irrelevant with the professional thing, skip it. No problem. In that whole thing, after the purpose, I didn't see any specific information that I could relate to. Okay, if you see, you have written over here that she participates in this sport, non-smoker. Okay, if she is non-smoker, why are you writing that she is non-smoker? Just leave it. Okay, if you are not writing, if I'm a reader, I will eventually understand that patient doesn't smoke. Okay, that's fine. Okay, so there's no need to make things complicated and making it, a bit lengthy won't help. She had a history of painful period till her first miscarriage, which was in April 2008. Okay, see, I can see and I can relate that this is a letter in which you might be talking about pregnancy, and I have no problem with it. But this happened in 2008, right? Before that, okay, that she started to have this menstrual pain from 2001 until 2008, somehow, if I'm not wrong, when she had her first miscarriage. It was like 8 years she suffered with this problem. After that's gone. Now you're writing the letter in 2020 after 12 years. Okay, it is not that important until and unless you're writing this letter to a gynecologist. Maybe. But this is a GP to GP referral, so eventually you just have to write the important things. Patient will go there, will tell the history, your letter will be there with the patient. Okay? So write things which are relevant. Okay? You might think this is relevant, but if you think that deep, 12 years ago this happened, that I don't think that way. Okay. And her second miscarriage was on 10 week. What is 10 week? On in 10 week in August, which so it was the August 2008, and there are no 10 weeks in August. If I'm not wrong, there are only 4 weeks in a month. Okay, on 10 week in August 2008. Okay, so I can see that you are trying to tell that she had this miscarriage when her pregnancy was of about 10 weeks, right? So mention that, when her pregnant, like the gestational age, or maybe the pregnancy was of 10 weeks, when then she had a miscarriage. She had a history of gestational diabetes, prolonged labor, and forceps delivery by episiotomy in July 2018. This paragraph is poorly written. I am not. This is not a good way to write this paragraph. If you see the case notes, it was written. You could just simply write that. Please note, and every history should have been written in a single paragraph. So you can just, I'm talking about this clinical history. So you should have written that, Mrs. Jackson had had 2 previous miscarriages, okay, in 2008. Okay. She also had a history of gestational diabetes. Okay. Her daughter, okay, was born via forceps delivery. Okay. In July 2008. That's it. Nothing else. 3 sentences. We have written 1, 2, 3, 4, 5, 6 lines. Okay, I hope you have gone up one. In view of the above, I would be grateful if you could further monitor. Okay, so is there something in this whole thing which is talking about monitoring? Is there any arrhythmia going on which you want to monitor the patient? Okay, or is there something, you are sending the patient for blood pressure, orthostatic hypotension, okay, or maybe hypertension, okay, anything like that where she needs monitoring? No. Okay, just because you thought that I will write little different word, okay, and that is the reason you have selected the monitor word, okay, but if it is not monitoring, he's not gonna monitor. Okay, he is going to take this patient into his care because the patient is moving to that place and you don't know for how long, maybe 10 years, 20 years, maybe for the rest of her life. Okay, so write words which are appropriate. If you could further assess, okay, so he has to assess the patient, but whatever the condition of the patient is at the moment. Okay, we cannot go along with the patient and say, okay, let me monitor you. No, that's not going to happen. Okay? Rest of the things are fine. I hope you have got my point. This is what you have to include whenever you're going to write a letter. Okay. Next letter, Dr. Sar, I hope you are here too. Okay, age is fine. Sorry, date of date is fine. Yeah, okay, that's right. 836 years. No problem. Let's just focus on the things, okay? Because we don't have time and we cannot take any chances. I'm writing to refer Mrs. Jackson into your care for management of her anxiety, which is increased due to her shifting to particular. Okay, see, the person is a general practitioner. He might not be able to manage the anxiety. Okay, the current situation is that patient is pregnant. Okay, along with the anxiety. Why? Because she is moving to particular fasting the second period because of her pregnancy. She doesn't know how to cope up with the patient. Okay. So if I were you, how would I have written this paragraph of the purpose? I'm writing to refer Mrs. Jackson. Okay. A pregnant female, okay, pregnant female who has presented with increased anxiety levels, your further assessment, okay, in this regard would be highly appreciated. Okay, that this is a little better version. Okay, she is a saloon manager, married, and has a 28 months old daughter. She drinks alcohol and participates in recreational sports. Her father died at the age of 70 due to cancer. See what you guys are doing. It's like when I write, sorry, when I read letters, there is a vibe coming that when because you guys are just following things, okay, and the structure somehow is getting better. The problem is that you guys are just getting the whole information out of the cases and putting down over there without even thinking. Okay, married and stuff, 28 months old daughter. Okay, see, this is not something which anyone will like. Mr. Jackson came for regular checkup in my clinic from July 2019 to June 2019 for mild symptoms of anxiety, but she refused to take medicine due to breastfeeding herself. See, just write breastfeeding. That's it. It is not possible for someone to breastfeed anyone else except the child, right? There are some words which are on their own contain a full meaning. Okay, just breastfeeding will make sense. Okay, her anxiety was improved after her baby started sleeping 6 hours at night. Yeah, this paragraph is very well, okay, and very compound one. Okay, very fine. On this date, I would prefer if you write on 01/08/2020. That would be the better way of writing. a day. Mrs. Jackson came with mild symptoms of anxiety. She again refused to take medication because no, she was planning for another child. Okay, not is. Remember, this is a huge mistake if you are making these kind of things. Okay, I hope Professor you're getting my point. Okay, because we discussed this thing in the previous lecture. You cannot make a smoothie. Okay, you don't need to add apples and bananas and some dates and some maybe some almonds or pistachios, and okay, let's just create a smoothie. That might be beneficial or healthy for drinking purposes, but here in the letter that won't help. She was counseled for lifestyle changes, okay, which she refused. Okay, on this date, her pregnancy, whose pregnancy? This is what I'm saying. Whenever you're writing a next thing, just write with the name. And see, these two paragraphs, they're very tiny paragraphs, 3 lines and 2 lines. Okay, so why would you not just mix them up, just merge them? How would you do that? You can just say on subsequent visit, her pregnancy was confirmed. Okay, and again you have written she has been feeling. She has been feeling anxious. No, she was feeling anxious because this visit is of on 10/8/2020. Okay, the previous visit. Yes, she has been feeling. It means she has been feeling from maybe since 1999 when she might have you know born. Okay, like if she is 36 years old, let us assume she was born in uh, maybe 1990. So from then she has been feeling anxious. How is that possible? Okay, no, that's not good. So she was feeling anxious. See how the words are changing, how the meaning of the whole sentence is going to be changed. If you just write one word up and down. I hope you're getting my point. I just try to give you guys examples so that you guys can think when you write. Okay, that what is going to be the eventual meaning of this line, what I'm writing. If I'm writing something in the past, okay, and then I'm writing something in the present perfect tense, present perfect continuous tense. Okay, so something was in the past, and that past is going on. So past is past. Okay, if something is going on, that is not past. I hope you're getting that. That is present, which is perfect. You can say perfect in nature, but not past. Past is gone. Your yesterday is not gonna come tomorrow. Tomorrow is a new day. Again, on her today's visit, she is anxious regarding losing her work, family, and friends, which is affecting her sleep and appetite. She requested for home delivery, which is not recommended. That's just recommended. Okay, to her, no, which is not recommended due to her previous pregnancy complications. Should pass medic. Again, you guys are doing the same thing. Again, see, smoothie. Again, like there is an envelope. Okay, inside the envelope, you're putting a letter, and you know, the two sides of envelope are the history. Okay, let's just cover them up. Okay, this is not a safe way to write a letter. Okay, so now what you have done, you guys have created a dig. Okay, a big dig, a huge one. Okay, and you have put your letter in that. And now what you have done is you just have uh, uh, you know the soil is your this history. Okay, and inside the letter is this is the best example that I can. So why would you guys write it? See, I have told you guys the basic organization of the letters. Okay, see, whenever we are going to write a letter, there is an organization that we have discussed in a in an hour class, and we discussed that thing twice or thrice maybe in last week. Okay, the problem is that if you're not going to follow that particular organization, things are not gonna work. And I'm not saying to make you guys feel uncomfortable. Okay, and I don't want to uh you know I don't want you to be in a fear. Okay, but problem is that if I'll not say it, the thing will not go into your mind. Okay, so I would definitely say it loud and clear. If you will not follow what I've taught you, things will not work. You guys will not pass. Okay, if you follow the way I'm teaching, this is not, I might be just teaching you guys, but the criteria is given by the official OET. Okay, if you're not following the criteria, then things will not work. Okay, because this exam is not about, like just like ICE. It's not like ICE where you have to just, you have been given a topic in which you have to write a letter or write an essay. Okay, no, that's not the thing. Here they have given you the case note. You just have to select the case note. You have to write them. You have all the information. It means like everything is given. Okay, and everything is there. Everything has served to you guys. You just have to take the spoon and the fork, and you just have to eat that. That's it. If you're unable to eat properly, and if you're creating a mess while eating, they are not gonna forgive you. Okay, so please listen to me on that. Okay, Dr. Wafa, I hope you are doing good and you are here. Okay, 6 I'm writing to refer Mrs. Karen Jackson, who have anxiety with the moment of particular for assessment and management. Okay, I'll take it. Had mild anxiety. Sorry. Mrs. Jackson was planning for another child on this date. Her pregnancy was confirmed. Now, Dr. Afasi, these are very tiny sentences. 3 words and sentence is complete. Okay. Mrs. Jackson had mild anxiety. Mrs. Jackson was planning for another child. Okay. We are not in a, in a primary school or the middle school or maybe the, we are out of it now. We have to write compound long sentences, not that long definitely, but we have to write compound sentences. Okay, so you can just write on this date, Mrs. Jackson presented with mild anxiety. Okay, as she was planning for another child. Okay, okay, so one sentence. Her pregnancy was confirmed on the subsequent visit, and she was anxious about coping up with the baby. But she was anxious that how she was going to cope up with the baby, whatever the way you want to follow. I'm not following it. Okay. I was anxious about how to cope with the baby. Okay, this is also fine. Okay, so the compound. So the whole 1, 2, 3, 4, 5, 6, 7 lines would have been written in 2 sentences. Why? Because the page is small here. If you say the surface area of the page, it's not like very wide. It's quite small, right? Today, Mrs. Jackson has presented with the complaints of increased level of anxiety, or has presented with the raised anxiety level. Okay, because see, in the case note there was a Django kind of arrow that was telling you guys that the anxiety has increased to an extent where you have to refer like where you have to mention it. Okay, Mrs. Jackson has complained of poor sleep and appetite. Mrs. Jackson has requested. So not see, whenever you are starting a paragraph, once just write Mrs. Jackson. The next words or the sentences should be written with she. Okay, not Mrs. Jackson, Mrs. Jackson, Mrs. Jackson. Okay, just one time you have to write Mrs. Jackson, not many times. She has requested a home delivery, but it is not possible due to her previous pregnancy complications. Mrs. Jackson is also taking over the counter to prevent miscarriage. Okay, so let me tell you one thing. It is better to write if the patient is currently on some of the medication, right? So you don't know for how long they are going to take it. Okay, so it's better to write in indefinite sentences. How? Mrs. Jackson takes over-the-counter multivitamins to prevent miscarriage. Now here you have written OTC. OTC what? Is it a painkiller? Is it a multivitamin? Mention it, okay? Mrs. Jackson had one child. Her father died due to cancer. Her mother is hypertensive and brother is diabetic. Mrs. Jackson had a history of serious miscarriages. Her anxiety improved and her baby started sleeping 6 hours. So now, no, this sleeping six, this and that. What you have done, your letter, Dr. Wafa, it's quite short. It's really very short, I would say. And the sentences are baby sentences, I would say. Okay. What you have to do now in the next letter, try to write more comprehensive letter. Okay, like there is no problem with your English skills. I won't say that there is a grammatical issues. Okay, grammar is fine. Problem is little with the organization and the sentences. Okay, the structure of the sentences. That the structure is not good. Okay, try to write a little long sentence, a comprehensive one, a compound one. Again, the next thing is select the relevant case note. In this case note that was given, okay, if you guys can see the case note, there were many visits. This from July 20 to July 2019, the only good visit was written by Dr. Sara. Okay, she came for regular checkups in my clinic from July 2018 to 2019. So this visit was actually the base of starting of this anxiety thing. So you guys should have mentioned this in a proper way. Okay, the way she has mentioned. Dr. Sara has mentioned this in a beautiful way. The problem was with Dr. Sara and Dr. Uh, Shahida's letter is that they have made an envelope. Okay, okay, so that was not good. But overall, you guys have written good letters. Okay, but you need to improve with some of the sentence mistakes and things. Okay, so yes, this was a good way of writing it. So this was the important paragraph. Okay, then the next two paragraphs could have been merged. Okay, I'm talking about this 1A 2020 and 10A 2020. Like on this visit, she presented and she reported anxiety. Okay, we asked her to improve the lifestyle. Okay, and were discussed about medication, which she refused because she was planning for another child. On subsequent visit, her pregnancy was confirmed. That's it. And she was anxious about coping up with the baby. That's it. Okay. So the next two visits could have been merged. Okay. Then the third paragraph would have been about the today's visit she presented today with increased level of anxiety as she is moving to Park Relay, and she will lose or she is going to lose her work, family, and relatives. Okay, and okay, she also has reported poor sleep and appetite. She has requested a home delivery, which is not recommended because of her previous pregnancy complications. Okay, yeah, so that's it. This was all about today's visit, and then you should have written about the history that on. Okay, she is she has had two previous miscarriages. Okay, in 2008, 18, or sorry, 2008. Okay, in you can just in 9th and 10th week of gestation or pregnancy, whatever you want to write. Okay, and then next one, please note, she also had a gestational diabetes during her last pregnancy. Okay, she had a prolonged labor. Okay, and delivery was with the forceps. Okay, so these things could have been mentioned in the past medical. Then you could have please note. Her family history is positive for hypertension, cancer, okay, and diabetes mellitus. Okay, so just simply you could have mentioned, okay, there's no need to write brother was diabetic, mother was hypertensive, father died because of cancer. Okay, that's not required. You just have to mention the family history is positive for hypertension, diabetes, and cancer. That's it in a single line. Please note her family history is significant for hypertension, diabetes, and cancer. That's it. Okay, this is how very compound, very comprehensive letter would have been, written, and you guys might have got 37380. Some of like Dr. Shaila and Dr. Sarah letters are good. Dr. Ufa, your like sentence the grammar is fine. Somehow the organizational and sentence structure issue, these two things are there. Okay, and you have skipped the relevant information that I've explained. Please add that. Except that, everything is okay. We are on the right track. We have time. We are following things. We are assessing each and every line and word. Okay, so I hope and I'm very much confident that at the end of the session, you guys are going to face it by the grace of Allah. So yeah, this is it. If you guys have any other question or you guys have to talk about something specific, you guys can ask me because these three are the letters that I can see in the group. Except that I cannot see any other. Okay, so if you do not have any question, then we can summarize.